Powerful currents are reshaping our world. Climate change, aging populations, inequalities, conflict, and technological advances are transforming the way we live and the health of our societies. While these megatrends bring challenges, they also open doors for innovation and bold, impactful change. To navigate these currents, the second European programme of work will be our Health Compass, guiding us toward a healthier, fairer, and more secure future for all. Your voice, our future.
Welcome everyone to the third of our hearing series to shape the second European programme of work. I am Natasha Azzopardi-Muscat and it is my pleasure to be your host today. We are delighted with this opportunity to have the ability to reflect and shape together the future of health and well-being in Europe with you, member state representatives, non-state actors, academic partners and others. And thank you for joining us. In our first two hearings, there were almost 2,000 people connected. Our focus today is on health systems of the future. And where I am in Copenhagen, outside it's rather glum and gloomy. So I invite you this Friday morning to spend the next couple of hours really focusing and thinking on the health systems of the future. But before we jump into the content, I am honored to kick off the conversation with our regional director, Dr. Hans Kluge, who will be followed also by two ministers of health, Minister Timur Musayev from Azerbaijan and Minister Monica Garcia from Spain. Thank you everyone for joining us. And Hans, I'm missing you by my side in the studio today, but I'm delighted that you were also able to join us. And as you know, last October our member states passed a new vision for health systems across the European region, committed to building resilient and sustainable health systems for the future. And we know that technology will play a big part in this vision. So perhaps we can kick off if I ask you, what is your view for the role of technology, digital tools, big data, artificial intelligence in shaping and transforming European health systems?
Thank you. Do you hear me well, Natasha?
Absolutely, Hans, and I see you well too.
Good. It's very nice to see you, and good morning, Minister Monica Garcia, Minister Dr. Timur Musayev. Thank you so much for joining, colleagues. Actually, I'm sitting here in the cabinet, the medical cabinet of my father in my home country. So I'm really into the mood of health systems of the future, Natasha. And as you know, I was 2 days having high-level discussions in the European Commission with the new Belgian government, and discussing a lot about health systems of the future. And technology is omnipresent in all discussions, indeed. But what really comes to the fore always is about the health workforce. Whenever we talk to colleagues, to health policymakers, decision makers, the biggest crisis, I was also in the European Parliament, as you know, in the Public Health Commission, there's a lot of concern about the health workforce crisis. So how can the technology help? Number of points. The first and foremost, and I know that you and me think alike, Natasha, on this, that the human contact will always remain very important. The empathy. It are very anxious times. I also see it as my daughters. And there's climate change. There are wars on our continent we could never imagine. So the human contact will always remain very important. But of course, we have to embrace the technology, the interface. We know that there is a shortage of doctors, nurses in many countries, be it in West, be it in East. So in that sense, digital interface will become and should become more and more important, because we know that in many emergency units in the hospitals, people come which could be perfectly managed by general practitioner or even digital. The other thing, I'm speaking from my practical experience as a general practitioner, was I had to spend too much time on paperwork, on administrative formalities. So with the AI, this really can and should help us to spend more eye-to-eye time with the patient and less with these administrative formalities. And then, of course, I think all of us who have been a patient at one point of time know that the integration of health services in whenever country is still a big challenge, right? The interoperability, electronic prescriptions, the coordination between hospitals, primary care, community care, social care. If I'm an older person, I need a wheelchair, I need the hearing apparatus, I need different specialties. So the interoperability is very, very important. So there is a huge potential. Ultimately, what I would like is that the people in my region, our region, the WHO European region, say that we have a health system where there is almost no waiting time, where there's a smooth transition between health and care and social providers, and that I have a say, I guess. I have a say when policies are being made. Thank you.
Thank you so much, Hans. And you've really kicked us off in the right way. I suppose listening to you, it's quite clear that you are talking about the fact that we want patients to be able to trust that their health system will be there for them. And of course, this was at the heart of our vision document that was elaborated also at the Tallinn Health Systems Conference. And thank you for bringing the patients in, because my question to Minister Garcia is actually focusing on the patients, on the people. Of course, we know that technology that serves to empower individuals to take control of their health and well-being can be very important and will play an important role when we talk about health systems of the future, where people and patients will do more for themselves. But how can stakeholders collaborate to ensure that this vision is truly inclusive, person-centered, and works for those underserved communities? I know that this is a topic that is very close to your heart. So what considerations can you share from Spain's experience?
Hello, everybody. Hello, Natasha, dear director and minister, dear colleagues. Thank you for the kind invitation to participate in this forum first. I want to share Spanish Ministry of Health's commitment developing technology and artificial intelligence in healthcare with the goal of making sure that it directly improves people's health. We are working on training plan for healthcare professionals that covers different fields and makes possible to use this technology in consultations, operating rooms, and health centers. To make this happen, we are investing in research into new knowledge areas and new professional roles. At the same time, we are facing the challenge of leaving no one behind by educating the people and working to eliminate the digital gap, making an easier access to technology while promoting a more ethical use of the AI data. The Spanish AI program for the national health system is focused on using data to cut down the bureaucracy and support professionals with diagnosis and decision-making. We are leading the way in the EU, creating a shared framework that helps to accelerate the integration of research and innovation into healthcare. Spain has a public healthcare system with a shared digital history where 92% of the population has access to information. We have information systems based on primary care records with anonymous data from around 12 million people and a hospital network with data from public and private hospitals. When using shared data, we must take sure the data is of good quality, available, and protected in order to guarantee that always respects people's rights. The main challenge of digital health in the 21st century are aging, chronic diseases, and the shortage of healthcare professionals. In Spain, we are developing digital health programs as part of our national health strategy, with fairness and accessibility being the main goals of these technology-based policies. Examples include this: personalized digital care plan, UNICAS, pediatric rare diseases, CIGENES, genetic information management system. Adapting to the new challenges, this is not an option, but a must. The quicker we do it, the better it will be for everyone's health. Thank you all for your attention and for sharing this essential forum to discussion. Thank you very much.
Thank you so much, dear Minister, dear Monica, for making the time to share these thoughts with us. Indeed, you mentioned the importance of moving fast, but of keeping fairness and access and meaningful impact for people and health professionals at the fore. And now I would like to warmly welcome Minister Timur Musayev. Thank you for making the time to be with us. And Minister Musayev, I know that you are very much thinking all the time, how will health systems in 10, 20 years from now look like? So perhaps you can tell us, what are the 2 or 3 powerful ways in which you believe health systems in 10, 20 years' time are going to be different to what they are like today?
Your Excellencies, dear Dr. Kluge, honorable participants, ladies and gentlemen. I'd like to thank the WHO European Office for organizing today's hearings, that really taking a proactive approach to the future of healthcare systems, and more specifically, the future of each of us. Healthcare has seen rapid technological advancements over the past decade, a pace that has accelerated even further in the last 2 to 3 years. I believe we need a unified future health policy under the umbrella of the World Health Organization. One key question we must address is whether a citizen's initial contact with healthcare should be through digital platforms or directly with a medical professional in person. The future of health systems will likely be more predictive, personalized, and participatory. The healthcare industry will shape a combination of technological advancements, data-driven decision-making, and shift towards personalized medicine. Even today, AI, big data, and digital solutions play a crucial role in improving healthcare services. To fully integrate these technologies, it's essential to incorporate AI into legislative frameworks to ensure responsible and ethical use. AI has the potential to enhance efficiency in several ways. Automation of repetitive tasks such as scheduling and documentation can allow healthcare professionals to focus on patient care. Predictive analysis can forecast staffing needs. It could be based on patient inflow, seasonal trends, and workforce availability. At the same time, digital tools can enhance clinical decision support. AI-powered diagnostics can assist in early and more accurate disease detection, accelerating decision-making. Big data analytics can help identify public health trends, enabling targeted healthcare strategies. AI chatbots and virtual health assistants can provide basic medical guidance, helping triage non-urgent cases. Digital learning platforms can offer on-demand education to keep healthcare professionals up to date with latest advancements. However, as we integrate AI into healthcare, we must ensure fair and unbiased use of AI-driven decisions through appropriate regulations and ethical guidelines. The future health policy should prioritize data security, patient rights, and AI governance to prevent cyber threats and misuse of sensitive medical information. Another key aspect of the future of healthcare systems is sustainability. To minimize environmental impact, reduce energy consumption, and promote sustainability, we must increase the number of green hospitals and invest in energy-efficient healthcare facilities and sustainable medical waste management. While digital tools offer immense benefits, they should complement, not replace human interaction. These technologies should serve as supportive tools, enabling healthcare professionals to dedicate more time for direct patient care. By leveraging AI and digital solutions, healthcare systems can alleviate workforce shortages, enhance care quality, and create a more sustainable and efficient future. Thank you again for giving an opportunity to talk about very important topics that actually push us towards, I believe, bright future. Thank you.
Thank you so much, Minister Musayev. In a short while, you have really painted what the health system of the future should look like. Again, you have emphasized the importance of ethical frameworks, the importance of fairness, and you outlined more or less some of the breakout sessions that we will have in the second part of our hearing today, focusing on personalized medicines, on environmental sustainability, and others. So stay with us, because some of the topics which Minister Musayev so eloquently outlined, you will have an opportunity to have a deep dive later on this morning. But Hans, if I may come back to you, having heard these two amazing and insightful interventions, I think they both very much touched on equity. And we know, dear Hans, how important this has always been to you. Leaving no one behind has been also your hallmark for the first European program of work. So perhaps you have some reflections that you want to share with us, having heard Minister Garcia and Minister Musayev.
Thank you. Thank you so much, my dear friends, respected ministers. I think, Natasha, a key takeaway message is positive. I like very much always the positive approach, both by Minister Garcia, Minister Musayev, because in these times we need indeed to be optimist. And what you showed, both ministers, is it's possible, on one hand, to strengthen health systems, make them stronger, but also advance solidarity, equity, to indeed leave no one behind. But that it's not happening by chance. You have to do it, a deliberate effort, put it in your policies. And I saw this in Spain when Minister and me launched the WHO primary healthcare demonstration platform, where countries can go and see for themselves what is modern primary healthcare, a modern health system linked to the community, taking advantage of digital without losing the human approach. On Azerbaijan, my last mission was when there was the successful COP, and please, Minister Musayev, convey to your leadership, again, congratulations for this very successful conference. And I was very impressed how Azerbaijan is looking forward to environmental sustainability, incorporating models into the medical curricula of the students on greening hospitals. I remember there is a plan in the next years to green all the hospitals, moving forward, smarter, greener, and again, connected to the community. So these two short, very concise presentations give me a lot of hope for the future, that when we tailor deliberately our policies, not only to strengthen the system, which is a bit abstract, but really around the people, that a lot is possible, Natasha.
Thank you so much, dear Regional Director. Thank you also to the ministers. And with this, we wrap up our high-level introductory segment, which I think was actually not very high level in the sense that already we have started diving deep into rich content material. But it's my pleasure now to introduce Boje Eliasson, who is the Director of Health at the Copenhagen Institute for Future Studies. And fun fact, as we were chatting and preparing for this morning's hearing, Boje shared with me that, like me, he too is an islander coming from the Faroe Islands. And so we were discussing a little bit how islanders tend to respond to storms. Are health systems going through a storm at the moment, Boje, and how do we steer them safely into the future safe harbor? Over to you, and thank you for making time to be with us today.
Thank you so much, and I would also like to thank very much for this very, very important initiative. It has never been more important. It is a storm. In calm water, you can play around. In storms, you need to know how to play, and this is where we are now. These are changing times, but it's also an opportunity to really make the changes that we have looked for many years. For us who work in health, this is not just an opportunity, it's an obligation. We have a responsibility really to push health forward. And this is what we have been working about for the last years on building health as the most important societal pillar. How does that look like when we build health as the resilience factor in societies? So, as also said by the previous speakers, and thank you so much for these very good interventions and topics that we had on the table, we see a huge challenge where we see breakdown in the system. But if we go deeper, we can also see that we never had more technology, we never had more persons, we never had more tools or knowledge or actually funding in most societies, and still it doesn't really work. And this is because we have some trends that are pushing us in a different direction than when we established the health systems 150 years ago. And we must also admit that we are intervening too late, so the 30% of the disease burden we deal with should be avoided because we should have caught that before. So this really takes us to the next questions on, are we doing things right so you can improve the things that we're doing? But are we doing the right things? And this is the real question. We need to refocus on what is it that matters. And this old saying of, if you don't know where you're going, any road will take you there. But the addition here is that it's probably not where you want to be. So that we need to define together. So it comes back to change the way we think. That is the real obligation we have in this work. Over the last years, we have heard a lot about the fourth industrial revolution, especially on new biology, or biology in different ways, genomics and others, data, digital functions, imaging, smart materials and others, but it has been a volume approach. What we really need to go into now is a quality approach. How do we make this work for the individual, for the community, for the society? How do we provide it so it helps people and not something that people need to adapt to without really seeing what it's for? So here the luxury as a futurist is to say, what if? So we can play around like kids sometimes, and I think everybody should. But what if health was the most important societal pillar? The one that provides social equity, equality and fairness. The one that gives the sustainable growth and prosperity. The ones that is realizing the well-being economy, which is also very important to WHO Europe. But also reducing the avoidable disease burden and working with the resilience and security and safety of countries. So health should not be something we do when things go wrong, but something we do to keep things good. And here comes the core question. What do we really want? Is it the best health system or the healthiest population? It's not a black and white answer, I know that, but the healthiest population needs to be our goal, and then we need to reconfigure what a health system is and what we do outside of the health system. Having in mind that a lot of the improvement we have had over the last 100 years did not happen inside the health system, but with the health system and outside, where we got rules and regulations on clean water, schooling, sewages, food safety and other things that are necessary in order to keep people healthy. In Nordic Health initiative that we started in 2019, we pushed really on, okay, what is the division we need to have? Preventative versus curative in a health system. We will always need the curative. The Nordics are using 10% of GDP on health, on the health budget. And here we, with leading decision makers, we made an aspiration on saying that half of the budget needs to be preventative. Primary, secondary, tertiary prevention, not just health promotion, but really going in and working early and precise with the technology we already have. It doesn't even require more innovation to start with this. We have it. It's about applying. And just to show here that we all know that we should be on really down on the early stages to start, but no system starts paying before we are really ill and when the quality of life is very low and when the cost of what we do is unnecessarily high, so we can help fewer people in that part. So our approach is really to push and start with secondary prevention on chronic illnesses. We know what to do to a large extent. We have the technology to intervene to a large extent. Here we really can improve quality of life, we can improve the impact that we do, and we can get much more value or health value for populations with the money that we have. So it's also about where do we start. An example of this is what we work a lot with in our respiratory health activities with COPD, which is the third biggest killer in the world, has almost no attention, and still it's almost totally avoidable and preventable. So how can we work with knowledge on that? And then I'm also co-chairing a working group with the WHO Strategic Partners Initiative on data and digital health, where my part is especially on the health outside of the hospitals, which is also where we need to apply the digital very much. But in order to do these things, we need to really think about technological, societal, and behavioral readiness at the same time. We need to mature and start working ahead before our technologies are ready, so we actually can apply these things. And this is a new way of thinking where we need to apply technical and adaptive change in different ways. Technical change is, you could say, in the box, where we improve things or finalize things a bit better than they were before. Adaptive thinking is the new way. How do we turn things around? How do we go more preventative? And you can't use the technical change toolbox for that. This is hard. There's no education in this. No university has courses on this. This is something we really need to push forward. Then back to a drawing from 2019, before ChatGPT and others could draw for you. So one of the conclusions we had in our Nordic health work was, what happens when you put the knowledge that exists, no new knowledge, the knowledge that exists in the hand of the individual, and give them tools to handle it themselves. So health literacy agencies to the person to work with that. And we have played a lot around with that idea on how do we give what is already there to the individual so we can start move forward, and with that also begin to have the individual to begin to produce data themselves, because we also need to work more with dynamic data, real-time data, to get into the loop. And here comes one of the big bottlenecks that we have, data protection. But we should protect people with data and from data, not just from data. We should produce data to help people be healthier. And this goes into many different programs in WHO and EU, and we are involved in some of them. Right today, the Polish presidency has a conference on health and security as a part of going forward. We do it with our Nordic Health program, where we push a lot, and Movement Health, that is a global movement that I myself was a part of initiating, has also this focus on how do we bring the digital parts to the table. Another part here, which we have also worked on with the Nordic, is how do we bridge individual and aggregated data? Our failure in our system today is that we are separating the individual data with the aggregated, so we can't go back to the individual. And as we also heard before, that the future will become much more preventive, that also means that we need to connect with the individual so they own, or at least have access and can produce data so it fits to their behavior in different ways. And these technologies exist, the models we don't have. So what we really need going forward is a future playing field driven by dignity. So we need to make the playing field so we can work with public and private entities in it. So it's really about balancing regulations so we have opportunities and also safety measures in it. It's really to move from lifespan to health span, so aging healthy in different ways. And the core here is to unify personalized and public health as one approach by being timely and precise with the technology that we have. So one way to look at this in a dimension is to say that these are 5 pillars. So one is improved technologies. The second is improved prevention. The third is improved treatment. The fourth is improving dignity and equity in whatever we do. And then with that also improved sustainability, both for the environment, but also for the health system in itself. So with these words, I would hope that I have inspired to this fantastic day that you have on these different hearings. And just say again that we have opportunities of a lifetime, but definitely also a responsibility of the lifetime, and we need to act now.
Thank you so much, Boje. I mean, I think I was again grateful for the way in which you brought in at the start public health, because we don't talk enough about it, or we don't often understand it enough even when we speak about it. So I really like the way that you brought public health right back into the conversation. But my question to you is, you've presented this very compelling and futuristic list of actions. Across the region, we have 53 countries that are quite diverse in terms of size, in terms of geography, in terms of level of digital maturity. Yeah. I think the message that you wanted to give us, however, is that everyone can start from somewhere. Yeah. Can you elaborate on that? Did I understand that well?
Yeah, yes, you understood that well. So also a core part of moving from the 4th to the 5th industrial revolution is to listen to where people are, not where technology is, right? And technology is a tool. It should never become our aim. And we need to become much clearer in a tool for what. So we have a lot of work done by WHO Europe, and Global WHO, all the regional partners on what we need to do. So we know a lot of what it is we want to achieve. And going to countries and really listening on what do you have of human capacity, what do you have of technological capacity, and then just start applying with what we have. So sometimes we need to start with what is possible and not what is achievable in 10 years. But we should always have the end goal in mind.
Clear. And in this sense, I think we have been rather fortunate in Euro with the fact that the digital health team is part of the health systems team, and we keep driving them all the time, as you say. Technology for what? What do you expect to change as a result? Even when we go to countries and ministers tell us, oh, our priority is digital and technology, yes. But what do you expect to change as a result? And I think we heard the 2 ministers at the start of our conversation. One last question for you, Boje, if I may, because I know you also have another commitment. You spoke about the strategic partnership initiative, the public and the private. In this world where so much of the data is actually in private hands, there are many people who are skeptical about the way in which we can work with the private sector. Some would be calling for tougher regulations, but we know that we find ourselves a bit in an anti-regulatory environment, so to say, at the moment. So perhaps a couple of tips. How can we work with the private sector? And how can we ensure that we really steer all this excellent innovation in the right manner?
Yes, I think this is probably the biggest bottleneck we have right now, both on how do we do this, but also how do we build trust while doing this. Where I think we as countries have failed is to say to companies, this is the playing field. You can play here, but these are the rules. So transparency and linkage data is going to be key for understanding health. But when you build that, you could as well say that any data that connects to you is identifiable to you. You should know about that and how it's being used. The technology to do so is there. The frames to require this from the companies, we have not done. So this is a homework for countries, for regional organizations, also for WHO, really to come together and say, okay, we want public-private partnerships in order to get the innovation. Let's define the playing field. In the end, we also need to be aware of that, for instance, in Latin America, where I worked a lot, we are not going to have overarching public systems over the next decades, because there is a lot to develop. So you need to do some kind of partnerships. So how do we go in and have the communication with the companies on saying, okay, how do you help us with these things? As a person, I'm most interested in the health service I get. And then I will trust the system, my public system, where I pay my taxes, that they make the frame that it doesn't matter who provides the service, a public or a private. The rules should be the same. The scrutiny should be the same. So to me, this is one of the big challenges that I also personally am investing quite some time in trying to work with.
And thank you also for investing that time to work with us in the Strategic Partnership Initiative. Once again, thank you for being with us today, Boye, and we will continue the dialogue also as we work our way through the priorities for the European Programme of Work. So looking forward to continuing this conversation and to steering all of this in the right direction. And I'm sure that your presentation today has really inspired our participants, and that they will be able to reflect on this as they also give us their inputs when using the AI tool later in the day. And now I would invite you to watch a short video before we segue into the next segment of our hearing today, where we will be inviting a number of spotlight speakers to share their views. And we're back again, and every time I watch that video, particularly after having heard speakers like the ministers and Hans this morning, it strikes me in a different way. I've been joined in the studio by my colleagues, David Novio-Ortiz, who heads the unit for data, evidence and digital, and AI now also, and Thomas Zapata, who heads the unit for health workforce and service delivery. So I was joking with them and saying, so now we have the faces of technology and the workforce. And for many of you, our member states and partners who interact with my colleagues, indeed, I think they are very much our outward faces, looking at workforce, looking at technology. But no worries, we're not going to have a fight in the studio, but we are always very much debating this and reminding ourselves. So Thomas never lets David forget that the technology has to work for the workforce. David pushes Thomas and says, but the workforce needs to be ready to take this technology up. And of course, we are all working together ultimately to make sure that all of this benefits people, the citizens, the taxpayers, the patients. But David, can I hand over to you to introduce our first lightning speaker?
Thank you so much, Natasha. So as a member states-driven organization, we are going to start with a country representative. So it's my pleasure to introduce Dr. Lynn Farah, that is Director of National Programs in Digital in Aging Well and Digital in Mental Health in the Ministry of Health in France. Welcome, Lynn. So France has been a pioneer in using AI in healthcare, and we have seen an increase of countries also working in Europe start exploring this technology, among others. So we know that ethics, data privacy, and sustainability are currently the key challenges that we are all facing. So we'd like to know from you how France is tackling these issues, but also what the lessons can you please share with us for other countries that they would like to learn from your experience. Lynn, over to you.
Thank you very much, David, and thank you for the invitation. As more European countries explore AI's potential, we must address, as you said, key challenges, including ethics, data privacy, and sustainability. So how has France tackled and is trying to tackle these challenges, and what lessons can be shared? Let me just introduce on a few words our latest events in France on February 10th and 11th with the AI for Action Summit, which was led in Paris. And at this moment, the French Ministry of Health published the latest report on artificial intelligence in healthcare, providing a comprehensive overview of these actions taken so far. And this publication was released during the AI for Action Summit, which brought together international governments in Paris to discuss AI's roles in shaping the future worldwide. So to provide a clear perspective, I would say, on France's approach, I will first highlight how AI is transforming our healthcare system and then address the ethical and regulatory frameworks we have put in place. And finally, I will take some concrete examples of this AI innovation and the challenges to implement them in the French context before discussing on how we can scale them with a responsible and sustainable way. So first of all, AI is presenting, as we said in this several presentation, unprecedented opportunities to enhance healthcare. And France's Future's AI strategy is backed by a substantial investment, including 500 million euro for digital health acceleration strategies, among whom 50% are dedicated to artificial intelligence health projects, enhancing public and private partnerships. Some of these public and private initiatives include AI for early disease detection through preventive models or AI-assisted screening. If we take an example, the DEEP project proposed an AI-powered connected medical device for early cardiometabolic disease detection. And the Incepto platform proposed an AI-assisted radiology improving cancer diagnosis. On the other hand, AI for patient-centered remote monitoring is also enhancing access to care through telemedicine and AI-powered decision support system. For another example in France, for instance, the Atelier platform proposes a collaborative AI-driven platform integrating remote monitoring device to track chronic disease patients. These projects demonstrate how AI is already transforming healthcare, improving patient safety, and optimizing clinical pathways. But France is also among the first countries to incorporate AI-specific regulation in healthcare. The Artificial Intelligence Act classifies most of AI-powered medical devices as high-risk systems, requiring rigorous evaluation. In response to this, our Health Technology Agency in France launched a descriptive evaluation framework, ensuring AI tools meet medical, ethical, and technological standards. We also launched a fast-track reimbursement scheme for digital health technologies, including AI-driven medical solutions, and thanks to the PECAN, which is an early market access pathways. We finally also are designing cross-sectors regulation and this cross-sector regulatory alignment to integrate AI standards with the European medical device regulation. And going more into detail with regulation, we focused on data. More specifically concerning data governance and privacy protection level, the French Health Data Hub, launched in 2019, enables AI-based research while ensuring data privacy compliance. It aggregates anonymized health data under strict ethical supervision. And to take an example, the Hydro project uses AI to predict cardiac decompensation in patients with pacemakers by securely analyzing French national health records. On another project, the French Ministry of Health has also implementing an ethical by design approach, ensuring AI solution adhere to 5 key principles: beneficence to improve patients' outcomes, non-maleficence to prevent algorithm bias, autonomy to ensure patient control over AI decision, justice and equity to guarantee fair access to AI-driven healthcare, and finally, sustainability to reduce the environmental footprint of AI in healthcare when talking about frugal AI. In France, these advancements align with a broader ambition, which is making healthcare more efficient, accessible, and human-centered. However, implementing AI at scale comes with regulatory, technical, and economic challenges that we are actively addressing also. This sustainability of AI in healthcare depends on its economic viability and environmental footprint. And France is also addressing this through economic model for AI integration, national evaluation framework, and sustainable AI development. We aim at reducing AI carbon footprint through optimized algorithm and green data centers. And we also integrate the AI into public health planning to anticipate demographic and epidemiological shifts, such as a junior project, which aims at using AI simulation to model future healthcare needs and optimize resource allocation for 2050. So our perspective and maybe some lessons to share include several objectives. First of all, frame aim at developing a clear AI strategy that aligns research, regulation, and funding to ensure smooth AI integration. Then the French Ministry of Health intended also to develop this robust ethical and legal frameworks before AI deployment, preventing bias, ensuring fairness, and securing patient trust. Then France decided to invest in AI training for healthcare professionals, ensuring that clinicians understand and trust AI-assisted decision-making. And as a fourth point, France is also designing a national health data strategy in alignment with the European health data space to leverage artificial intelligence for data-driven technologies, AI for public health strategies, enabling predictive healthcare planning and proactive patient management. So as a conclusion, France's journey in AI-driven healthcare offers valuable insights into balancing innovation, regulation, and ethics. By addressing AI challenges holistically, we are paving the way for scalable, sustainable, and patient-centric AI adoption. So moving forward, collaboration at the international level and with the public and private overview will be key. In France, we are committed to working with global partners, including the WHO, to share also this practice and drive responsible AI implementation worldwide. We are actively working for the forthcoming publication of our national strategy for AI in healthcare, which will provide also a comprehensive roadmap for the future development and integration of AI. Thank you again for giving us the opportunity to share this example on how we are trying to build a future where AI enhances global healthcare system while upholding the highest standards of trust, equity, and sustainability.
Thank you so much, Lynn. And I'm sure that this segment, people are going to return to the recording and watch it time and time again, because in a few minutes you have really outlined all the different elements that need to be taken into account. The innovation, the evaluation, the regulatory framework, and in a frank way also highlighted some of the challenges. We now go to Catherine Rouleau. Catherine is a professor of primary healthcare. She has been collaborating with us very much also in the preparation of the Astana Primary Healthcare Conference, and Catherine normally talks very much about the health workforce. But today, Catherine, I'm going to ask you, from your perspective, from the primary healthcare perspective, do you see technology as driving a paradigm shift in primary care? And then to come back to this question that was asked also earlier by other speakers, how can we ensure that in this quest for introducing technology and innovation, we don't lose the human touch, which is the hallmark characteristic of primary healthcare par excellence?
Thank you very much, Natalia, and dear colleagues, Your Excellencies. Thank you for this invitation to participate in what has already been such an informative and galvanizing presentation by so many knowledgeable experts. So to come back to your question, I will say first that I think I'd like to focus my remarks, of course, on primary healthcare, which, as we know, is the intersection of three components: the multisectorality, the community empowerment, and primary care. But perhaps I will focus actually on primary care and that interface between the community and the entry point into the health system, which is the space that I know best, because that is where I practice and work most of the time. And to answer your question, Natalia, I want to stress first and foremost, as we've heard from some of the previous speakers, that space of primary care can be actually quite super powerful, but only if it is fully optimized. And that actually requires, in 2025 and going forward, it requires technology and digital tools. But it also requires it, as long as some of our speakers have said, we keep a clear eye on the panels that sort of direct us, if you will, in the right direction. And I'm going to raise three specific issues that I have been mentioned actually earlier in the discussion, but I think really need to focus our attention. The first is trust. Primary healthcare as an approach and primary care services and the primary care space really only work when there is trust there. It is what brings people in. It is what keeps people engaged in their care. It is what motivates people to become healthy, to stay healthy, to cultivate their own health. And so we need trust. And as many have mentioned before, that requires attention to data collection, to data stewardship, to data regulation, as our previous speaker has spoken. The primary care space can have a role and has an important role to play in there and can motivate, inform, and weave actually with the system level people strategies to actually make the technology work for the health workforce, but primarily, as we've said many times already today, for the population. So trust and the development of relationship, allowing the use of digital tools and of data not to interfere with the development of relationships, but in fact to cultivate it, to enable it, to enrich it, something that in fact Hans mentioned at the very beginning of the session. The second big category of issues that I think we need to think about is the issue of equity, and how does the digital technology and the virtual space actually enable an enhancement of equity as opposed to becoming a barrier for it. So this means that we need to pay attention to access to tools and the actual equipment and systems that actually allow virtual and digital tool, but it also means that we need to think very purposefully, and we need to engineer the use of these tools and technology in a way that is for people and that actually draws people from the margins, particularly those who do not have a voice, typically, those who are structurally marginalized in our communities, those who might not have physical or financial access, but also who may recognize barriers in the kinds of care they receive. We need people to see themselves in the care they receive. This is particularly important in primary care. And there we need to be purposeful and thoughtful about how we're going to harness digital technology and the virtual space for that purpose. The third and final point I want to make is an obvious one, and I was delighted to see how many people actually spoke to this already across all of the presentations, and it's the issue of compassion and care. I think we all, as humans, we ourselves actually are well aware, and sometimes a little bit skeptical about the ability of the digital world to actually enhance or support, enable compassion and care. They sometimes fit in different parts of our brains, actually. Certainly for people from my age who weren't born into it, like some of the new generation, it takes a bit of effort sometimes to merge the two, to merge the heart and the mind and the human contact with the digital space and the virtual space. And this is actually something that we need to purposely address. It is not a natural and a harmonious cohabitation, if I can say this, particularly in primary care. We see it in the lovely video we saw where the doctor is actually focused on typing on a laptop rather than attending to a patient, even though I'm sure the doctor wanted to do so. But interacting and introducing digital technology in the middle of the care, both in the clinical setting, but in fact, even in the home where it needs to be as we move towards the future, really requires purposeful attention to make sure that we continue to express, cultivate, and develop compassion and care. Because at the end of the day, of course, as others have said, but I think is worth mentioning, there is no healthcare without the care. And so we need to make sure that the tools we develop, the systems we put around to help us optimize the contribution of digital technology and of information and data going to the future will actually allow us and enable us, support us to actually engage in a compassionate relationship that is attentive to the needs of the people, and that really allows us to move together as co-creators of health and well-being in our societies. I will stop there. Thank you again for the opportunity to speak to you all today.
Well, thank you so much, Catherine. Really interesting in raising those three main points on primary healthcare, in really building trust, which is so important. Second, on how primary healthcare, the importance on building equity as well, and then the compassionate element. Natasha was talking before about the human touch and how important it is, and I think you also emphasize it very well. And now I would like to move to our next panelist, which is Professor Johan van Eldere, who is the Secretary General of the European University Hospital Alliance. So welcome and good morning, Johan. Really nice to see you here. And as we were discussing the other day, Johan, what we see is that integration of digital technologies and healthcare systems has both challenges and opportunities for hospitals. And we see how the role of hospitals evolves from traditional acute care facilities to more comprehensive care hubs that integrates also primary care and long-term care as well. So in that sense, these challenges and opportunities becomes really critical, understanding this. So Johan, from your perspective, can you tell us what these challenges and opportunities are and what you believe needs to be taken into consideration to really improve the situation and develop policies for the future? Thank you.
Well, thank you, Thomas, for having me, and thank you also for this public hearing. I think it's a very timely and interesting hearing to have this at this particular moment. First of all, let me stress that we as university hospitals see the enormous potential of digitalization. And all of our members, we have members in 11 countries, all of them big university hospitals, we have been experimenting a lot with digitalization. Just to give you an example, we asked our members what they did in order to alleviate the stress due to the workforce problems. And of the 50-odd solutions, they gave the majority, 2/3 were digital. And those digital solutions focused primarily on hospital at home, telemedicine, following patients to PROMs and PREMs. It goes to show that we believe in what digitalization could do in moving healthcare forwards, in facing the challenges that we are encountering, and also in transforming healthcare from hospital-based to preventive. But what I would like to stress is that we also believe that digitalization is a technology. It's certainly going to be important, but it's not the only thing, and it's only a means to an end. And this has already been highlighted, I think, by some of the previous speakers, that it is a technology, but that on the whole, we should focus on prevention, prevent people from going to the hospitals. As I already mentioned, I think digitalization is not going to solve everything. And even in our day-to-day use of digitalization, we encounter hurdles and challenges. And I would like to highlight some of those hurdles that we that we are facing. First of all, I'm not going to talk a lot about artificial intelligence. I think some of the previous speakers already highlighted sufficiently all the problems and the challenges that include artificial intelligence. But with digitalization in general, one, I think, of the main hurdles that we as university hospitals are encountering in the field is that within the current regulatory context, and I am specifically referring to the European Union regulatory context, it is difficult to innovate. And what I would like to stress is that innovation is not only big industry, the big companies, it is also the day-to-day incremental innovation in digitalization that happens in our hospitals. It is this culture of innovation that also will give rise to the big innovations. But what we would like is that the regulatory context, and it's already been referred to by some of the previous speakers, like GDPR, but also the Artificial Intelligence Act and the MDR, that this regulatory context would be relaxed so as to create and incentivize a culture of innovation within our hospitals, which we think is absolutely necessary to make it possible to innovate in a digital way and to face the challenges that we are facing in healthcare. The European health data space has already been mentioned. We believe it has an enormous potential, and we are certainly looking to become early adopters. But at this moment, we think that there's a heavy burden on the data holders, being the university hospitals, and not sufficient compensation for the effort that goes into accumulating and making available all of these data. We know that industry is worried about protection of the intellectual property, but there's also an enormous intellectual effort on the part of the data holders, and we would like this to be better compensated, to be better rewarded. Some of the other issues, and already also being touched upon by some of the previous speakers, is the increasing amount of data that come from lifestyle apps, from wearables. These are often in the hands of private companies, but specifically in view of what's been mentioned by the previous speakers about the importance of prevention, we think that it is absolutely essential that these data are available and form part of the electronic health record. If we talk about prevention, about lifestyle changes, about preventing chronic diseases, we will need to be able to access those data and see what they can teach us about prevention of these chronic diseases. So we think that here too, there is a regulatory context that needs to make it possible for these data to become part of the enormous amount of health data that should guide the reform of the healthcare system in the future. Digital literacy and the digital gap has already been mentioned. What I would like to add is that also in terms of the staff in our hospitals, we did a kind of survey amongst our staff members, and there is some trepidation amongst our medical staff regarding artificial intelligence, regarding the possible impact of artificial intelligence on their jobs. So it is something that needs to be included and that we need to look at if we want artificial intelligence, digitalization be accepted and used in the hospital environment. And finally, there is one area where we think that more regulation, more standardization should be useful, and that is on the level of the data. When we try to do benchmarking, when we try to compare data between our different hospitals, there's an enormous variability, not only in the level of digitalization, but also in the way that data are entered into the system. And we do think that there's an urgent need for more standardization, more harmonization across countries in Europe to be able to exchange those data, to use these data, not only for primary use, but also for secondary use. So here, in contrast to my previous arguments, I would encourage, for example, the European Commission, but also countries to work towards more regulation, towards more standardization and more harmonization. And finally, I think my take-home message would be that we know very well what possibilities are, what problems are. What I would say is, let's focus on implementation. Let's start doing it in practice, not in research projects, but in everyday life. We will undoubtedly encounter hurdles and problems, but we will try to solve them along the way. So my final message is, let's start doing it. Let's not too much talk about it. Let's start doing it. Thank you.
Thank you so much, Professor Van Eldere. A means to an end. That is the quote that I would like to retain from you. And also the need for focusing on implementation. But we would like to add that to focus on implementation with a people-centered approach. And that is the reason now we are going to have with us Dr. Mohamed Al-Ubaidi, who is the CEO of Patient Know Best in the UK. Thank you so much for joining us today. So, Mohamed, you know that people and trust are a crucial part of this successful digital transformation journey in the healthcare. And technology and data science are quickly evolving. So, from your point of view, looking at policy measures that can help ensure equitable, people-centered approaches that can help us to bridge this gap between digital divide and fostering trust among the base communities, what do you think that we should be doing to ensure that this gap is bridged? Over to you.
Thank you. In the 1960s, home kidney dialysis experiments started in London. And in the 1990s, a new generation of radical kidney doctors believed that patients should also have the data at home. Now today, Europe's largest disease registry is the kidney dialysis patients in the UK, whose patients get their data to self-assess and self-manage. Now, kidney disease, diabetes, HIV, and increasingly cancers, these deadly diseases are now long-term conditions where what the patient does at home matters more than what the doctor does in the hospital. And not everyone can do everything, but a lot can do a lot. Furthermore, increasingly, patients are the ones with the most and the most accurate data. Precision medicine is built on the genotype, but applying it correctly requires the real-time phenotype. So what's happening right now, accurately, in the body of the patient? What should happen next, given what we know about the patient's genetics and medicine science? So for that real-time data, patients have more data and better data than doctors do. We learned this when Japan asked patients to take blood pressure measurements at home in the 1980s. The measurements were more accurate without white coat hypertension, but they were much more accurate as it became much more frequent. Frequency is quality. Your smartphone is with you most frequently. Its camera can already accurately detect heart rhythms. The accuracy of measuring hemoglobin and cholesterol levels through a smartphone is also rising. Now, when a patient knows what to do, they can do it right now. And the sooner you deliver the right care, the lower the cost and the higher the quality, as you prevent disease progression. Now, in every country, the clinical workforce is overstretched, as we're hearing. They need the patient to understand and act. And patients who do so will have better healthcare, better care and better health. So that means in practice right now, patients are the largest and latest providers of care. It's the patients who inject insulin for their diabetes, take the inhaler to prevent asthma attacks, and use the dialysis machine at home. So if you realize the importance of these patients, you as who are providers, you design the healthcare system differently. You design to deliver with the patient, not to the patient. So I'll finish on the policy recommendations. You'd make sure the patient has access to all of the data immediately so they can act right now. You'd make sure the data comes to the patient in a computable way. So it has to have the medical coding system so that medical knowledge can be applied to it by software automatically. And you'd allow the patient to share that data with any party they want so they can get the latest support from digital tools. Apps that focus on your disease or simplify for your learning disability or adjust for the blind or adapt to your way of thinking. That's how you design for the workforce of the future, the patient. Thank you.
Very good. Thank you so much, Mohammed. And I think for bringing that concrete example of how to bring data to patients. And now I would like to introduce Professor Bettina Lundgren. Bettina is the head of the National Genomics Center in Denmark, here in Denmark. And Bettina, when discussing about health systems for the future, we often hear the terms genomics, precision medicine, and artificial intelligence. So as the head of the National Genome Center, can you help us understand what the perspectives are on these terms, and if there is anything that we should promote and be mindful about?
Thank you very much for the invitation and for sharing the Danish experiences on implementing precision medicine and genomics in Denmark. So precision medicine use of genomic and other healthcare data will be part of future health. I think we need to, in a wise way, use the data we have, and therefore the Danish government, the Danish academics and the healthcare system agreed on a strategy where we will actually move forward on using healthcare data, implementing genomics by supported by technology and infrastructure in order to use data in a wiser way. So that was actually supported by a huge grant from the Novo Nordisk Foundation in order to implement genomics and technology equally all over the Danish healthcare system. So we have, together with the Danish healthcare system as part of the state and governing that, implemented directly into healthcare in inherited diseases and cancer diseases. So patient would actually benefit from new technology and genomics directly into healthcare. I think it has been a huge task for all of us because, like we also heard from previous speakers, that it's new technology, it's a different way of working, but by implementing it nationally, we have used knowledge sharing across hospital systems, across healthcare regions, across medical specialties, across different healthcare professionals in order to learn how to work on better use of genomic and healthcare data into giving the patients better treatment up front, but also gathering these data, genomics, in a genomic data platform so they can actually be used in order to develop more precision medicine for future patients and for having data reused. We have a trust also in Denmark from the patients, so they actually sign consent so data can be used for future research, which is very important, so that we can actually learn from treating the single patient for actually benefiting future patients using the healthcare genomics and healthcare data. So I think it's important that there are initiatives in countries that you actually try to implement these new technologies, that you learn from them, that not only learning nationally, but also learning internationally. So we work together across the European countries on 1+ million genomes, on also standardization, as we also heard from Johan, it's important to standardize these data, both within genomics, but also within other healthcare data. So I think it's important that we look, of course, into the policy in different countries, of course, of what can be done. So we respect that in terms of working across borders and not, letting data get out of the country, but keep it in a secure environment so professionals can actually work with these data. So I think it's important that to give on to you that it's important to have the strategy, it's important to have the political will to do so, but it's also it's important to have all stakeholders involved in implementing in order to do so. It can be difficult in the beginning, but when you ask now 5 years up front, what have actually been benefiting this, you can hear from the from the healthcare professionals that they have really benefiting from having a national initiative. They have benefiting from learning from countries abroad, and it benefits the single patient for having a better, a more targeted treatment. And also what we hear from the healthcare professionals is that we can also attract more medical studies in Denmark by having a better use of these data. So I think it's important for nations to actually have a strategy, to work on a strategy, to push it forward, but also respect the stakeholders and, of course, involve patients in this so they can have a say and they can have, to agree on what they want to share, to discuss the ethical dilemmas that comes as things move on. And from where we are now in Denmark, we have the genomic database. We need to further implement technology and combine data for designing future health. So I think these are the experiences that we want to share. We, of course, want also to move more into artificial intelligence. We are not there yet, but we are working towards it. Like some of the other speakers also told, we work very much across countries, which also I think is very important that we learn from each other, and not only in Europe, but across the world. So I'll thank you very much for having the opportunity to share what we have been working on in Denmark, and that you can succeed if you want. It's hard work, and you need to focus, and you need to take one bit at a time, and then it's actually possible to succeed on it. So thank you very much for letting us share these things with you, and hopefully that will be part of future health, and that we can still learn from each other. Thank you very much.
Thank you so much, Bettina, for that very honest and open reflection on the difficulties and the challenges, but the way in which you are bringing everyone together on board. I think this closes this segment also very nicely. So thank you once again to Lynn, Catherine, Johan, Mohammed and Bettina. And we have time for a quick lightning reflection. David, you heard all these lightning speakers. What is the main thing that stayed with you? And what are you going to work on in the next 5 years, having heard them?
Thank you, Natasha. So I think that I am leaving this session very happy, but also a bit concerned, right? There is a lot of work to do ahead of us. And I would like to emphasize on literacy, the need for literacy. I think that there is a common pattern along all the participants about the need to strengthen the health workforce, but also the people about digital skills. So looking forward from WHO to support this effort.
Excellent. So David has picked up digital literacy. Thomas, is it enough to make the health workers literate, or do we need to do more to optimize this relationship between health workforce and technology?
I think, Natasha, definitely, as you say, we really need to look at the health workforce in this change, because what I see, my reflection from what I'm hearing is that we are moving into a paradigm shift, and I think we need really to be prepared for that, and health workforce is going to be a critical one here. So as Natasha was saying, I think we really need to prepare for optimizing the performance of the health workforce so that we are able to use all these technologies to serve for the health workers and serve the population. And I think in that, I think health workers really need to play a critical and a central role.
Thank you both for joining me here in the studio. And Now it's time for a short break. Make a coffee, make a tea, have a breath of fresh air, move your arms, move your neck, do whatever you need to do to feel better and re-energized for our breakout rooms that start at 10:30. But in the meantime, you can also decide to leave a few of the thoughts and reflections we've heard from David, we've heard from Thomas. I'm sure all of you out there also have your reflections. Tell us what has resonated with you. What do you think are the 2 or 3 strategic directions or priorities that we at WHO Euro should be taking forward? So thank you once again for having joined us, and we look forward to seeing you in the breakout rooms.